Morning, ma'am. So my topic today is bilateral astrocytic hamartoma of optic nerve with retinitis pigmentosa. It is a rare association that was seen in a patient. So 43-year-old female resident of Bathinda was seen with progressive loss of vision, and the past history of patient was that the patient in the childhood, when she was 5 years of age, she had a progressive gradual painless diminution of vision, which was recently it was associated with watering, redness and photophobia, and eventually she had a complaint of complete loss of vision. There was no previous family history of the patient, but the patient's 12-year-old daughter, she had afflicted the similar complaints with gradual progressive painless loss of vision since the age of 6 years. On examination, rest of the findings were normal, but the vision of the patient was PL denied in both eyes. On fundoscopy, the glistening translucent mulberry-like pre-retinal lesions were seen over the optic disc with bony spicules present in the mid-periphery. The blood vessels were attenuated with cellophane maculopathy. On OCT disc, when it was done, we could see that there were dome-shaped thickenings with retinal hyperreflectivity and black shadowing and calcifications were seen in both the eyes. Blood profile of the patient was normal, viral markers were non-reactive. Also the patient was ruled out for tuberous sclerosis, as this is a common association with astrocytoma. Renal ultrasounds were done, but there was no abnormalities like renal cysts or angiolipomas present in the patient. This was the fundus photo of the daughter. And on the daughter's OCT disc examination, again the dome-shaped thickenings were seen with hyperreflectivity and calcifications. It was not as progressive as in mother, but they were quite relevant. So astrocytoma hamartoma, it is a benign tumor, yellowish grey mass with semi-translucent appearance. It's a rare one. Obviously the association with retinitis pigmentosa is again a rare association, and we need to see with other departments, as the daughter of the patient was a pediatric one, so we should have consulted the pediatrician, but the patient also we should have undergone the genome also, ma'am, but the patient was not very affording and they were not even interested in doing so that's why. Thank you so much, ma'am.
Having this rare association and the patient was not affording genetic thing, but which type of gene are you suspecting will be affected? Which type of a genetic? It is autosomal dominant. No?
It is autosomal dominant.
So which type of panel of gene you would have advised for this case?
Ma'am, we could not advise at the first.
No, which you would have advised. He could not do it. It's different. You know the panel of genes, no?
Yes,
so which one would have you advised?
TSC gene is associated with astrocytoma.
Yeah, but that is also an association with retinitis pigmentosa.
Yes, ma'am.
So that is what panel of genes would have asked?
RB gene, ma'am, that could have been.
RB gene?